Double dissociations, I think, are important for neuropsychologists who are trying to discover or work out the sort of modular organization of our cognitive systems. And I think this is particularly the case in trying to understand the organization of our knowledge systems. So by a double dissociation, take the example of animate and inanimate. First, we describe patients who were very impaired in their knowledge of animate things, but had preservation of their inanimate things. Now, this pattern of performance gains a lot of strength by the description of the opposite, and it is the opposite pattern with the impairment of inanimate objects and the preservation of the animate, that it's this crossover that one describes as a double dissociation, and suggests that these two systems must have a degree of independence. Well, these were the two sort of major and first sort of compelling descriptions of category specificity. But I think it's true to say that since then, further, more fine-grained dissociations between preservation, selective preservation or selective impairment of categories have been described. And then there's also the slightly sort of orthogonal dimension where we think in terms of parts of speech rather than in terms of, if you like, taxonomic categories. So we now know, and I think it's pretty well accepted, that the dissociation between nouns and verbs, and this has resulted in a double dissociation. The impairment of nouns particularly is knowledge of nouns. It's quite common place. I think Ros McCarthy and I were perhaps able to describe a patient who had lost the meaning of verbs, and this then constitutes a double dissociation, and indeed we reinterpreted, if you like, some of the agrammatic syndromes in terms of loss of comprehension of verbs rather than of syntax. There are a number of examples of more fine-grained categorical effects. For example, a patient that I studied with Pat McKenna, this was back in the late 70s actually, she observed that when she was testing somebody on their proper noun knowledge, trying to identify people, always identified them by their nationality. So trying to name a picture of Gandhi, said Indian. And so we wondered if whether this triggered the experiment. We wondered if this patient had preserved his knowledge of countries. And so what we did was, we're still using this test today quite regularly, put together a test that consisted of 50 drawings of common objects. Pat was sent home that night to come back the next day with 50 pictures drawn by hand of 10 objects, 10 animals, 10 parts of the body, 10 countries, and what was the other one? There were definitely 5 categories. Anyhow, this patient was asked, A, to name all these 50 items, and was then asked in an array of 10, point to the dog, point to the cat, point to the colours. And So then we had these 10 colours, point to the green, point to the red, and then maps, point to Italy, point to United States, point to Wales, etc. And he could do the countries. He could both name them and understand their names, and he was at a loss with the other categories. And this effect has now been replicated in several more recent cases, but that's what started that line of inquiry.